What if I told you that if you just changed the way you breathe, you could have better blood pressure, better sleep, better health, and a more attractive face? Hi, I'm Dr. Lindsay Trottier. I'm a doctor of acupuncture and Chinese medicine practicing in San Diego, California. I've already made a video about how to do deep belly breathing, but today I'm going to talk about a phenomenon I'm seeing in my patients in the clinic, and it's mouth breathing. Did you know that mouth breathing can significantly change your blood pressure, change your ability to get good quality sleep, and change your ability to fight off infection? There's a lot of research that has been done, especially in the past few years, about how mouth breathing can really alter our face, it can alter our health, and it can alter our wellness. And one book that I would like to showcase for you is this book called Breath. This book does a really good job of explaining how the way we breathe changes our health, and I would really encourage you to read this. But I'm going to give you the highlights. What I've seen in my practice is so many people are not even aware they're not breathing through their nose anymore. And this is very obvious because they are having a lot more sinus problems. They're getting respiratory infections much more easily. They're not recovering from them. And these things are also increasing their chances of vertigo. That's dizziness. It's also increasing tinnitus or ringing in the ears. And these are things that I'm getting a lot of success with acupuncture and herbs in my clinic, but also because I'm teaching my patients how to breathe better. I've noticed in the past few years, I still have to wear a mask in my clinic, and having something over my face has actually started to make me mouth breathe a little more. And I first noticed this in about mid-2020. After a few months, I started to get palpitations, I started to get nervous, and I started to realize that I was mouth breathing. I wasn't breathing through my nose as much anymore, and it was severely altering my sympathetic nervous system, which was making me feel more anxious. I also have two small children, and one of my children has Down syndrome. If you know kids with Down syndrome, they have this cute little button nose, but also what that means is they don't have as much space in their sinuses. They also commonly have low muscle tone, and that low muscle tone can extend to smooth muscle, which is the muscle that we don't think about using. It just works on its own, like our intestines and our other organ functions. So we have smooth muscle in our sinuses. And my sweet little daughter, she will easily get cold viruses just like any other preschooler. However, it has been much harder for her to vacate that mucus. So what happens is that mucus will just sit in her sinuses for days and weeks, and a few times even a few months, until she could learn to blow her nose, which anyone knows it's very hard for children to blow their own noses. So what would happen is, because that mucus was just sitting here, not being moved out through the sinuses, it would sit, it would turn green, and she'd get infections. So what was making it even worse? Well, she was having to wear masks everywhere. So not only is she not breathing through her nose anymore, which is getting these muscles to move, getting activation through here, she's now breathing through her mouth and not having to use this at all. So one thing that we started doing is we started using mouth tape for her. And you can see this is for children. They do have adult size, but it has this hole that goes around the mouth like this. So she can still talk, she can still breathe. We didn't start using this until she was 4, and we observed her to make sure that she was actually starting to breathe through her nose. Within days, we saw her sinuses open up a lot more. She was starting to get over infections a lot quicker. We just had to retrain her to breathe through her nose. I've been suggesting this for my patients in the clinic as well, that they get mouth tape for when they're working at home, for when they're sleeping, because the mouth breathing can also make not just the sinus is weaker, but the muscles in our throat weaker too. And what do we know about when this starts to get weaker? We start to snore. And when we start snoring, what do we get? Sleep apnea. Sleep apnea is really known to cause much more dramatic health problems in otherwise healthy adults. So you can try stopping your mouth breathing with simple tape, but what I also encourage you to do is this breathing exercise to make sure that you can actually feel if there are any blockages in your nose, and so that you can help clear those out. I've made a lot of videos on how to take care of your sinuses. I'll link them below. You can use a neti pot, you can do massage, you can use a facial roller, gua sha. Lots of things you can do to keep this area open, but breathing is going to really help you. So what you can do is nostril breathing. So you're going to take 2 fingers and a thumb, and what you're going to do is plug one side, inhale, plug, exhale, and then repeat. Inhale, plug, exhale. So it looks something like this. You do this repeatedly, you might get things to move, so have a tissue ready. This is all gonna really make you aware of what's going on here. I've had patients, once they start doing this, realize they had not been breathing through their nose for days, weeks. A couple of them said even after a few years, they didn't realize they weren't really using their noses to breathe. And it's very important, and it's going to make a big difference in your health. So, I encourage you to look more into this. If you're still having trouble making these changes on your own, then you can consult with a licensed healthcare professional who is knowledgeable about helping you improve this area. Acupuncture works really well. Herbal medicine works really well. You can always consult with me. You can go to my website, levelacupuncture.com, and we get you breathing better and feeling better. Thanks. Have a great day.